Good evening, everyone. Thank you so much for joining us. My name is Nayyab Hanif. I'm a third-year medical student at the University of Illinois College of Medicine. I want to thank KSB Wellness for allowing me to come speak to you today about a topic that I'm very passionate about, and I'm really excited to be able to share with you. So we're today going to be talking about melanoma, so awareness, prevention, and the impact on rural communities. So given that, May is Melanoma Awareness Month, and given that melanoma is one of the most commonly diagnosed cancers nationally with around 9,000 cases every day being diagnosed, and, with that as well, with rural communities being impacted on average more, I think this is like a really important conversation to be able to have. So without further ado, let's go ahead and get started. So I always like to start with, background on what is melanoma. So essentially melanoma is a specific type of skin cancer that develops in the skin cells of our body that produce pigment. So those are known as melanocytes. So essentially, although we know that melanoma is a much less common type of skin cancer compared to, others such as basal cell and squamous cell, it is considered a much more aggressive cancer, which is why, its awareness and its prevention is so incredibly important. And so essentially the reason why melanoma is known to be more aggressive is because of its metastasis potential. So its ability to be able to spread to other organs of the body is why essentially it's considered to have a worse prognosis if it has progressed to that level. So I always like to provide a bit of a diagram. So essentially what I wanted just to illustrate here are, where are the melanocytes that are proliferating abnormally, right? So essentially we have three layers of our skin. We have an epidermis, a dermis, and a subcutis. So the melanocytes are essentially sitting between the epidermis and the dermis. And so you can see there's kind of like this juncture and this border, and between the squamous cells and the basal cells are where the melanocytes sit. So essentially it's those cells in particular, as I mentioned, that are getting impacted by melanoma. And then, squamous cell carcinoma, basal cell carcinoma, those are a different conversation for another day. Those are also types of skin cancers in which those specific cells are abnormally proliferating. So the main idea is that, we have a baseline of cells, and those cells, when they kind of get damaged, they start to grow in ways that are not normal to our body. And that's what we define as cancerous. So that, we have four different types of melanoma. The first one is called superficial spreading melanoma. The second one is called nodular. Third is lentigo maligna melanoma. And the fourth subtype is called acral lentiginous melanoma. So to kind of quickly summarize what each one of these are. So superficial spreading melanoma is essentially kind of what it sounds like. It, affects more of the superficial layer of the skin, and it's often noticed as like a dark spot, changing in shape, enlarging in size. So this type essentially is the one that tends to grow in more superficial layers, as the name, mentions. Nodular melanoma, again, it's sort of in the name. It'll look like a bit of a nodule or kind of like a growth that's distinct and raised. So essentially, we can have, black or brown nodules, which are often, misdiagnosed or, misthought of as a mole or a nevus that's benign, but essentially that can also be considered a melanoma. Similarly, there are different presentations that can present with nodular melanoma, specifically with it also looking pink or red in appearance as well. So those are the ones where patients will usually say, okay, yeah, this looks a little weird. I've never had this before. What is this? So that's usually kind of how we see a span of how this presents. Similarly, with lentigo maligna melanoma, this is a subset that often affects older populations. And it's often seen in sun-exposed areas on the body. So on the hands, on the face, maybe sometimes on the neck, or where you tend to get more sun exposure is where this one will present. And what's tricky with this also is, again, it'll kind of just look like a really enlarged freckle or an enlarged area of hyperpigmentation that, people just think are maybe aging spots or sunspots. But the melanoma has the capability to grow within that as well. So, that's also something to keep mind of. And then the last one, acral lentiginous melanoma, in contrast to lentigo, are melanoma that actually proliferate and grow in non-sun exposed areas. So that can be on the palms of our hands, on the soles of our feet, underneath our nails. And what's tricky with this one too, why it often gets misdiagnosed or just people don't tend to think it's abnormal, is, oftentimes patients will assume that maybe it's a nail fungus or like it's a discoloration under my nail, it's nothing to worry about. I think I'm fine. But melanoma, as we know, can also grow underneath the nail beds. And same thing, it's tricky on the soles of your feet, on the palms of your hands. Perhaps on the palms of your hands, you have more direct access to take a look and notice some abnormal growth or pattern that's presenting. But on the soles of your feet, it's tricky. So that's why, the emphasis on regular skin checks with your primary care, with your dermatologist are super duper important, just to make sure, there's nothing that's there that you're not able to detect. So these are just some visual representations of, what all of these melanomas look like. So again, as we see, the superficial kind of looks like a more superficial discoloration. The nodular ones, as I mentioned, kind of have that raised and bump look to them. And then the lentigo maligna, as you can see, it kind of looks like a huge patch of discoloration, but then there's that little, middle area that's slightly darker. That usually is what we can, define as the melanoma. And then the acral, as you can see, on the foot and in the nail, have very distinctive appearances. So this is now with detection, the ABCDE rule of melanoma, which is very important and what we usually use for diagnosis often, and what we educate patients with as well, because it's a very kind of systematic way to be able to kind of ask some questions to yourself on how it's presenting. So when we look at the ABCDEs, we say asymmetry, border, color, diameter, and evolution. So what does that mean? So asymmetry essentially is, are the borders distinct? And I guess you can kind of essentially talk about asymmetry and border together, because if something is symmetrical, then it has distinct borders. So that means that if it's round, it's very distinctively round. The borders are marginated very clearly. And, there's really nothing to worry about with that. We can usually confidently say that it's within those margins and it's most likely benign, versus, when you're looking at something more malignant, there really is no symmetry. There are no borders. It's a very random, patchy way of growth that can start to, proliferate in ways that are just not, what we would normally assess as contained. And then similarly with color, if you say that, this lesion on my body or this area of hyperpigmentation is, even in its color and its symmetry and its border, then again, you can say that it probably has a higher likelihood of not being malignant, versus when it starts to grow and get larger and start to look a little bit more, again, just abnormal with its margins and its proliferation, then we start to say, okay, so now in conjunction with the appearance of it and the asymmetry of it, it's also getting larger. And then, finally, kind of along that line on a timeline, when we talk about evolution, this is incredibly important as well, right? Because essentially, if we say that we've had, this mole on our arm for, 10 years that has, again, following this pattern, if we say it's been the same size, it has distinctive borders, it hasn't changed color, and it's been there forever, then you can say that, okay, most likely, very high likelihood that this is benign, versus if I say, I've had this abnormal looking, hyperpigmented area on my arm, its margins aren't clear, and it's grown significantly in the past 4 months, then you can see how that then starts to ring bells to assume that, okay, then this is something that needs to get checked out, because the timeline is not aligning with what we would consider as something benign. Clearly, there's something growing that's causing it to expand in the way that it is in the short time span that it is. So that's kind of how we delineate the A, B, C, D, and E pattern, which is, again, as I mentioned, incredibly important. So symptoms, the thing with melanoma, again, that's tricky is there aren't really any distinctive symptoms. Usually it's just the recognition of, a display of abnormal shape, color, or growth patterns on the skin. Oftentimes, maybe you'll go for your primary care appointment and you can ask for a skin check or be referred to someone who does skin checks, and maybe they'll find something and they'll ask you, have you noticed this? Have you had this for a while? And, then you can kind of go from there. So oftentimes it's either known to the patient or it's informed to the patient, maybe at an appointment. So essentially, you won't really have any distinctive symptoms unless sometimes if it has progressed to a point where it has metastasized or has become more systemic, then maybe some presentations of symptoms could arise, but that also just depends on, again, the metastasis potential and what grade or stage the cancer has reached to be able to definitively say, what symptoms someone may experience. So that's kind of, how we look at the symptom side. So diagnosis and treatment, if there's something that looks abnormal or something that looks concerning, then what often is done is a biopsy. And so a biopsy can be done excisionally or through a punch biopsy, which is essentially when you take a sample of that abnormal tissue. So a punch biopsy, it kind of looks like a little stamp, and you essentially punch stamp the skin and you take out a little piece of that tissue and you send it out to the lab, in which a pathologist, who's a physician who will assess those cells, will determine if it is malignant or if it's benign. So if it's malignant, then the next question we have to ask is, what is the grading, what is the staging, and the prognosis of the cancer, right? So obviously, again, this is why we emphasize catching it earlier means it probably hasn't spread as much, and the prognosis and the severity are going to be, the severity will be less and the prognosis will be better, essentially. Versus, if it has spread, then we have to start talking about, okay, how far along has it gone? What staging are we looking at? And then we have to really personally cater a treatment plan to ensure that we're doing everything we can to target that cancer. So the different therapy options are, removal, obviously, of the cancer first, and then we can talk about chemotherapy, targeted therapy, radiation therapy, and immunotherapy. So what's really spectacular about targeted and immunotherapy is, those are now, advancements in which we can target the skin cells directly by injecting the therapy into the cancer. So that is something that we can directly target the cancer with, but more systemically then is when we start talking about chemotherapy and radiation. So again, there's a lot of options, which is really good to know, but at the same time, everyone will vary in terms of what treatment they will typically need. So these are the options usually that are presented. So prevention, super duper important. Obviously, UV light radiation is what we want to avoid, and UV light exposure is what we want to avoid. So essentially, avoidance of tanning lamps in beds. I know it's summer and I know that, everyone wants to maybe get a tan, but definitely this is something that we want to avoid because, again, it's just very direct exposure to ultraviolet light, which essentially increases the risk of skin cancer developing. And that's just something that obviously we don't want. Similarly, avoidance of the sun in the middle of the day when the sun rays are usually the strongest. Again, I know it's tough, it's summer, and there's always, usually something going on, but if we can avoid it as much as possible, then that's usually what we hope to do. So usually that time period between 10 a.m. to 4 p.m. is what we try to avoid. However, if you do have to go outside, or if you are outside, then we'll kind of jump down to the bottom of my slide here, in which we say then, please wear your SPF and sunscreen. And, that's incredibly important, essentially because the sunscreen is that barrier that'll protect you from those UV light rays. So essentially, to kind of define what SPF of 30 and 45 and 50 mean, the numbers essentially delineate how long that SPF is going to be protecting you for. So an SPF of 30 on average will last around 2 hours, versus an SPF of 45 to 50 can last anywhere from 4 to 5 hours. So the idea is obviously a minimum SPF of 30 is very strongly recommended. If you can get a higher SPF, then that's ideal, just because number one, it's less reapplication, and number two, it's stronger protection for longer times. So that's really important. Similarly, kind of coming back up to what we were discussing, I think being familiar with your skin, knowing what's normal and your baseline to be able to detect what is abnormal is super duper important. Now, of course, again, in areas that you can't see, like the soles of your foot or maybe your back, that's more difficult, and I can understand that, but just kind of generally knowing the patterns on your body and on your skin, I think is super important. And similarly, wearing protective clothing and accessories that help protect your sun from the skin, I think is incredibly important. So, I know in our community here, we're a farming community, or a lot of times we have occupational exposures to being outside. So, wearing long sleeves or wearing hats and wearing things that'll protect our skin from that exposure to UV light is incredibly important. So these are just some really great ways to be able to implement and integrate protective measures that can allow for prevention of melanoma. So lastly, I just wanted to kind of end on the impact of rural communities because I think it's incredibly important to talk about. So on average, we know nationally it is seen that the risk of melanoma mortality is significantly higher for people residing in rural communities compared to urban communities. And why we can usually delineate that and correlate that is due to the fact that there typically is access to care, lifestyle, and occupational exposure, as well as decreased awareness overall of melanoma, which is why conversations like today are super duper important. And so I think, essentially by being able to raise awareness of this topic to the community, it will eventually, I think, integrate into improving the overall health outcomes of the community and essentially hoping to bridge this gap that we see and being able to decrease this, mortality rate that is being experienced on average higher in rural communities. So finally, I just wanted to link some resources that I think could be really useful if you'd like to learn more about melanoma. So these are just some links that I've provided if you'd like to do so. Otherwise, I think it's super duper important, stay in touch with your primary care physician and ensure that, you're able to talk to them about any, concerns that you're experiencing based on some of the things we've discussed in this presentation. And with that, I want to thank you so much for joining us today. And I want to thank KSB Wellness for allowing me to speak to you. And I look forward to facilitating future discussions. Thank you so much.